Now we have to drain the blood from the heart, so we have some veins that we'll talk about here. This one coming up, this one going around. This is all the same one, coming all the way around. Whoops, and it stops right there, okay? It's dumping into this bag again. That's the coronary sinus, number 27 there. That's the coronary sinus. It goes from here, let's say from here, all the way to there. And so this one, 28, is dumping into there. That is called the great cardiac vein. So let's trace it again. We've got great cardiac vein, wrapping around, boom, dumping right into there. This one is the posterior vein, okay? Also dumping into the coronary sinus. All the veins dump into the coronary sinus from the heart. Okay, so that's posterior vein. And then let's go ahead and go to the other side. We'll go to this right side first. So we've got, I'm gonna start with this one because we can identify it by the fact that it runs with the marginal artery. This guy right here is called the small cardiac vein. Now it's not just this portion, it actually is this portion that wraps around, okay? Wraps around, and there we go, we dump into the coronary sinus again. Okay, so that's a small cardiac vein. Any veins above that on the right anterior portion of the heart are called anterior cardiac veins. You only see one here, right? But in a lot of models and picture in the textbook, we've got one here and we've got one here. I even have a model that has 3 of them, okay? So any of the veins on the right side, anterior, above the small cardiac vein, we're gonna call them anterior cardiac veins. Let's go to the back. Between the ventricles, running with the posterior interventricular artery, we have the middle cardiac vein, okay? And I already showed coronary sinus a couple times, so we're good. Those are all the ones that are on our list, all right? Now we've got to do some structures inside the heart and go from there. So let's open this guy up. Okay. Now you've got muscle that lines the atria and on these auricles that we mentioned, and that muscle that's inside the atria is called pectinate muscle. Okay, so that's pectinate. So if you look on both sides here and here, okay. If we go down into the ventricles, let's look down here. So it looks like this stuff here looks like Freddy Krueger skin, right? So that rough-looking stuff there. That's called trabeculae carneae. It's in here as well. Think of it lining the whole cavity, okay? Then we're gonna have some muscles that are attached to the valves, and those are gonna have a different name. So this is trabeculae carneae. Up here we have pectinate, right? And then inside the ventricles also, let's see if we can find a good representation if you wanna get a little closer there. This right here, this muscle, so that bump, that is called a papillary muscle. Papillary muscles attached to these things here. These look spiderweb or cord-looking things. They're called chordae tendineae. And then they attach to the AV valves, which on a test, you're not gonna call it AV valves. You're gonna give them their appropriate names. Okay, so we're gonna name those. And then I'm gonna show you some more stuff on a smaller heart at the very end of this video. So this one right here is called the, it's on the left side, it's called a bicuspid, but it also has another name. It's also the mitral valve. So you could use either name on a test. If we go on the right side, this valve is called the tricuspid. Now make sure, if I'm on the cords, it's chordae tendineae. If I want the valve, I'll be right, the arrow will be right on the valve, okay? So if I'm right on the valve, on this side, it's tricuspid, think tri on the right, RI, tri on the right, and so that'll help you remember it. We have some other valves. Now those valves are the AV valves which attach to the chordae tendineae, which attach to those papillary muscles. If we go through the pulmonary trunk here, you've got a semilunar valve, which semilunar is the category of what it is or what type of valve it is because the little flaps look like half moons. But the name of this one is the pulmonary valve. We could also call it the pulmonary semilunar valve. I would accept either. You have to say pulmonary though. If we go up, let's go here, see if we can angle this just right. If we can see that, if you go up and through, and I'll show it on another model as well, but if you go up and through from the left ventricle into the aorta, that's called the aortic semilunar valve. Okay, or you could say aortic valve, I would be okay with that. Okay, so let's see if there's any other structures that I missed. I showed you the opening to the coronary sinus. The apex of the heart is really easy, it's just the point of the heart. I think that covers what I want to cover on this. Is a few more structures, but I think they're shown a little bit better on my small model, so I'll go ahead and grab that one now. We got this small heart here. We're going to open this guy up. I want to show you a couple of things on this particular heart. The aortic valve you can see a little bit better, so if you couldn't see it as well on the other, but just so you know where it is on both models, that's the aortic valve with the aortic semilunar valve. These are the, on the left side, bicuspid, right side, tricuspid valve. Again, the bicuspid is also called the mitral. And then look, these are really nice visualization of the papillary muscles here. You can kind of see the bumps a little bit better. They don't blend into the red like on the other model. And so you can see the papillary muscles of these little muscles that are going to yank down on these chordae tendineae, and that's going to pop up the little valve here and close it off. So it, again, blocks, when the ventricles contract, it blocks the blood from shooting back up into the atria. Okay, another thing I want to show while we're here is 95% of the heart is made up of the myocardium. So this is all myocardium here. This is also myocardium. I would probably point to it somewhere out here. But in the center here, which is myocardium, it's a structure though. And so if I point here, I'm going to be asking for the structure. And so that is called the interventricular septum. Now, another couple of things I just want to remind you of when you're taking a test, pay attention. Am I asking for the structure, the tissue? Am I asking for a chamber? Am I asking for a vessel? And so you really want to pay attention to those things. You also want to pay attention to the tip of the arrow, because as we saw, like on the other model, in fact, let's just take a quick look at this. Here's the coronary sinus on the back here. But when we look at the other model and we have all these blood vessels on there, you know, they're really close to each other. So we want to make sure we're paying attention to what's at the tip of the arrow. We want to make sure we're paying attention to what the question's actually asking. And that pretty much covers everything we need to know for the heart. Stay strong. I'll see you next time.